Welcome to Then. This is Dr. Pat Rush presenting breakthrough science about the connections between trauma, health equity, and neurobiology. By the end of this brief video, you will see health and disease in a different light, and you can apply this new knowledge in your teaching, research, patient care, and your own health. We are dedicated to improving health, and we expect medical science to be based on the latest research and promote a deep understanding of health. We expect our system to be effective, inclusive, and compassionate. Universal access and health equity must be a priority. Has medicine made progress toward these goals over the past 50 years? As this video discusses, despite trillions of dollars and decades of hard work, the results are very disappointing. Why? Our conclusion is that the problem is not funding or a lack of research. The problem is that medicine is using an outdated model. We propose a model that is both new and old, a model that sees the brain and body as an interconnected system. We know that trauma and health disparity are widespread. Could all these problems be connected? There are thousands of research articles on the impact of trauma and health. Yet there is still very limited training for physicians and healthcare professionals. We want to pause for a moment and acknowledge that understanding the origins of disease requires talking frankly about trauma, including physical abuse, sexual abuse, neglect, and more. Part of our discussion is about the cruel impact of discrimination. Trauma is personal for everyone. Then's website offers resources about the roots of trauma and about healing. Now, let's take a closer look at how medicine currently understands health and disease. We find many missed opportunities. Medicine needs new thinking, which means examining the underlying scientific assumptions. What is disease? How does disease occur? And what promotes healing? Today, our case study will be a reevaluation of hypertension, also called high blood pressure. We chose hypertension as our introduction because it is the most common chronic disease, affecting almost half of American adults. 500,000 Americans die each year from hypertension-related disease. The annual cost is $150 billion. Hypertension is common, deadly, and expensive. Let's look deeper. Currently, hypertension is seen as what is called a risk factor for heart disease and stroke. It is seen as a separate, less dangerous disease. This may seem like a small technicality, but stay tuned and you will see how the idea of separate, disconnected diseases is a big mistake and leads to failure in prevention and treatment. Equally important, anyone who has experienced discrimination. Gay men are twice as likely as heterosexual men to be diagnosed with hypertension. Hispanic and indigenous peoples are more likely than whites to have high blood pressure. Black Americans have the highest rates of hypertension and highest mortality. Hypertension is also closely tied to America's astonishingly high rate of women dying in childbirth. Maternal mortality in the United States is twice that of other wealthy developed nations and 10 times higher than in Sweden. Hypertension is the second leading cause of maternal mortality and is still increasing every year for Black women. How are doctors and healthcare trainees currently taught to understand this important disease? Hypertension is still seen as an idiopathic disease, no known cause. Treatment is exclusively focused on prescribing daily medication, and hypertension is seen as unrelated to patient life experience, sleep, or brain regulation. Is this state-of-the-art science? No. What is the modern science of hypertension? Over the past 30 years, hundreds of research articles have shown that the cause of hypertension is known. The cause is inflammation and narrowing of blood vessels. Hypertension is closely tied to the patient's life experience, especially everyday discrimination. It turns out that what medicine is still thinking of as a separate disease has been well documented as a multi-system brain-body dysregulation. Harvard Systems Biology and the National Institute of Health have done careful research to determine how hypertension starts. The first step is dysregulation of the deep brain, which causes activation of cells in the bone marrow, resulting in inflammatory damage to the heart and blood vessels. Their research shows that brain hyperarousal actually starts years before hypertension is detected. America's current approach to hypertension is a tragedy. As you have seen, hypertension starts in the deep brain. What activates the deep brain? Fear. This study by Dr. Shakia Hardy and team showed that the transition from normal blood pressure to hypertension can start in Black boys at age 8. Let's think about that for a moment. The past few years have shown the world why young Black boys could be afraid. Tragically, now we can see how all these seemingly unrelated social problems like parent-child separation, family poverty, predatory policing, and racism are actually root causes of serious health problems. And we can see why out-of-date medical concepts must be changed. In the National Library of Medicine, anyone can find over 100,000 peer-reviewed research articles showing the connection between experience and health. We are sorry to report as medical school and university faculty that we are still unable to get our institutions to focus on this important science. Why are medical science and healthcare so stuck, and what can we do about it? Our response was to form then. In 2017, we started a small, nonprofit, multidisciplinary think tank. With our distinguished advisors, we have created a new, innovative approach, including free online education. We are asking essential questions about the structure of science, how to improve health outcomes for our patients, and how to improve the work experience for those of us in healthcare. Causes and solutions are connected. As the example of hypertension shows us, applying basic principles through the lens of system science can help us understand and prevent disease. It is time for medical science to let go of the fragmented silo model, which separates physical from mental and which mislabels social determinants as just risk factors. We offer a new model, recognizing that the brain and body are one interconnected system. A person's experience, positive and negative, matters. Traumatic experience disrupts regulation. By consistently applying new core scientific concepts, medical science can find a new direction. This new understanding of disease is not just better science. It provides hope. It points to new methods of diagnosis, prevention, and treatment. And it provides a roadmap for our work toward health equity and social justice. What is our strategy? Then's first step was to build a network of experts. We want to connect with them and learn from others. we welcome students to join us. Our second step was to create our knowledge library, which you can visit on THEN's website. Our third step is free online education. Gaining and applying new knowledge requires mastery of new concepts. Our website includes a curated bibliography, an illustrated glossary, plus a curriculum with brief videos. How can you be involved? We invite you to join us in learning and sharing this important science. Please visit our website, subscribe to THEN's newsletter, and follow us on Twitter and Instagram. We can guarantee you this is the most exciting science of your life.